In early 2011, in a quiet Pakistani garrison town, a doctor went door to door handing out free vaccinations. He spoke to parents and their children lined up, sleeves rolled up to receive the vaccination. It was like any healthcare drive seen all across Asia. Nothing seemed unusual. But this campaign focused on just that one neighborhood. It didn't expand outwards. Once those houses were completed, the paperwork was left unfinished. There were no follow-ups. The doctor running this drive was Shakil Afridi. Publicly, he was a health worker, but privately, he was cooperating with an intelligence investigation by the CIA. The objective wasn't really disease prevention. It was intelligence gathering. US intelligence believed in the tiny town of Abbottabad, the world's most wanted man was hiding. But they couldn't bug his house. They couldn't get any information. So they resorted to collecting DNA and matching it with samples they had from family members in the US. Even a partial match to him or his family wouldn't really prove his identity, but it would give the intelligence a lot of confidence. The plan never really delivered useful DNA. They weren't able to enter the compound where he was hiding. But before the intelligence could prove fruitful, events overtook this operation. On 2nd May 2011, the US Navy SEALs invaded the compound and shot dead their target. The man found there was Osama bin Laden. The consequences weren't limited to this raid. Soon after, Dr. Afridi was captured by the Pakistani government and tried not for espionage but under some local law. And he remains the most controversial figure of this whole episode. Once this vaccine story was made public, the damage spread beyond intelligence circles. Vaccine hesitancy grew. Public health workers were attacked and in some cases even killed. Polio eradication campaigns, already fragile, grew even worse. Many regions were inaccessible. Healthcare workers were accused of being spies. Disease surveillance suffered. Many global and local health organizations were forced to withdraw. Public health is built on trust, and trust, once broken, is really difficult to rebuild. What started off as a tactical operation in Pakistan damaged trust worldwide, especially in zones of conflict. Vaccines became feared, and doctors became suspects. One wanted man was found and killed, but millions suffer the consequences of the decision even today.